Dr. Ian Mosby was doing his postdoc at the University of Guelph fairly recently. I think it was 2012, 2013, and he was doing research on nutrition, and he started to uncover this research that seemed odd to him. It wasn't explicit. There wasn't anything that was blatantly obvious in some of the research literature, but he started to see, they conducted research on in reserve communities, like on reserve for children, residential schools. So Dr. Percy Moore was the superintendent of medical services for Indian Affairs at the time, and Frederick Teasdale was part of the Royal Canadian Air Force. This research was funded by Indian Affairs, that's what it was termed then, the Milbank Memorial Fund, which was a large American funding body, the Royal Canadian Air Force, and the Hudson's Bay Company. So researchers in the room, if you got funding by these four institutions, that's huge funding. That's big time funding. So this was a fairly large project. The study that Ian Mosby, where he wrote about this, it's actually in the Journal of Social History. The title is there if you want to go and find it. But Dr. Percy Moore was the co-inventor of Pablo. Very popular guy. And he basically conducted research on reserve. It provided the perfect experimental community. People couldn't leave. If you wanted to leave reserve communities, you needed, it was called a pass system. You needed permission by the Indian agent with a letter that said you were allowed to leave. As a researcher, how many times have you lost a research participant, right? They couldn't leave. But they also didn't even know they were part of a research study in the first place. And what happened here, I'll just quickly do an overview. It was a controlled trial where they had the perfect environment. They had starving children, right? So they kept children in the starvation mode, and they gave nutrients to another group of children. And they looked at the differences between the two groups. They took pictures of teeth. So when you read your cereal box and you see niacin, thiamine, iron, thank First Nations residential schools and Métis residential schools. That's where that research originated from. At the time, they knew that the tuberculosis rate was over the top, right? And as researchers, you know that if you uncover something happening in a community, even if it's unrelated to your research, you have an ethical responsibility to do something about that. Yet they did nothing about the tuberculosis rates. Ian Mosby summarized, in the end, these studies did little to alter the structural conditions that led to malnutrition and hunger in the first place, and as a result did more to bolster the career ambitions of the researchers than to improve the health of those identified as being malnourished. Ian Mosby summarized this in 2012-2013. He's now on a circuit. Ian Mosby's actually doing presentations, probably globally, but especially in Canada. He is doing presentations on research ethics as a result of uncovering this. It doesn't stop there, though. There was some research done in the 80s. Dr. Richard Ward took blood samples from 900 people in a community in BC, and the study was for rheumatoid arthritis. After that, the blood was then used for a different purpose. The blood was used to look at genealogy and try to prove the theories that exist from a Western perspective on how Indigenous peoples have found themselves on Turtle Island. And we know that many nations have their own creation stories. So this research is very contentious, right? More and more people are finding artifacts that are disproving the Western theories of immigration to Canada or to Turtle Island. As a result of this, the TCPS has actually discusses the use of biological samples. 1930s, Maureen Lux wrote, and you don't hear about this very more. I had to do research to actually uncover it. 1998, quite a while ago, looked at research that was being done in southern Saskatchewan First Nations, and it involved vaccine testing for tuberculosis. Again, no consent, no voluntary consent. In the article, Maureen talks about the researchers at the time stating that the reserves were disease menaces for surrounding communities. But the research did nothing to fix the tuberculosis rates. So looking at housing, looking at crowded housing. Not necessarily research, but it implicates the medical field, right? And even as kinesiologists, recreation researchers, sometimes we are doing medical-based research. Have you heard about the policy in Alberta that allows for the harvesting of organs from children who die in care? Right? This is recent. This has become public. It was part of the Aboriginal People's Television Network. I think it hit CBC as well. And a chief was outraged that this policy exists. So children who die in care, their organs can be given up for donation without the child actually stating that they want this, let alone the parents who are no longer the parental guardian for this child. It's problematic because nearly half of children in care are First Nations, Inuit and Métis, right? Correlation there. Unfortunately, it continues. So I'm giving you some examples that probably might make you a little bit angry, but to recognize why research ethics has to exist. This one kind of hits a bit home for me, but the opiate addiction rates in our communities is very high. It's not high because we're drug addicts. It's high because we're getting prescriptions from doctors, right? My sister, Kim, she's 52, November 2013, she passed away from a methadone overdose that was administered by Methadone Clinic. So she had, a lot of Métis people, we have higher rates of arthritis. And so she had had several surgeries for nerve impingement, degenerative disc disease, all of that. She, of course, was given Percocets, right? Prescription of Percocets. Then she was given Oxycontin. She never was given fentanyl. And then the doctors are getting a bit nervous now when they prescribe opiates because of the overprescription of opiates. And they took her off the Oxycontin abruptly. Oxycontin is a narcotic. It's stronger than street-level heroin that we shoot up. They cut her off completely, no supports, right? If people are trying to come off of addiction, getting supports is very important. So she turned to a methadone clinic that was in Midland. Totally legal methadone clinic. The doctor is, I think there's 2 methadone clinics in Midland. It's a very small town. She started methadone, didn't tell the family because the family would have told her not to do it. People on the street know methadone is not an option. It's just another shackle. And on the 7th, they started her at 30 milligrams. She had chronic obstructive pulmonary disease. She never should have been started at 30 milligrams. And she went in on the 5th day, and she's exhibiting symptoms of overdose, right? But they're saying they mimic symptoms of withdrawal. They increased her to 40 milligrams, which is unheard of. The College of Physicians and Surgeons in Ontario actually wrote back to us and said they don't understand why they increased her so rapidly. And the doctor should have known she had a lung issue. She was actually in the hospital a year prior with 50% lung capacity, which never came back. So how could a doctor who was an emergency physician before not recognize that she had severe COPD, chronic obstructive pulmonary disease? On the 7th day, she never woke up. She actually stayed on the couch and she passed away. Unfortunately, this story, I did a request for privacy information, and I received the methadone overdose death rates in Ontario over the last 10 years. Lo and behold, Aboriginal people are overrepresented, even in the methadone overdose death, right? There was a doctor, Dr. Davies, had a clinic in Saskatchewan, and he overprescribed opiates, Percocets and Oxycontin, and then shuffled people over to his methadone clinic. The amount of money that people are making off of this is ridiculous, right? We have to really question that. So the distrust of the healthcare system, the distrust of researchers is palpable. It's real. So as a researcher, when you go into a community and you face that hostility, there's a lot of history there, right? You have to understand that history. Changing gears a bit. Chapter 9. I want to focus on the Tri-Council policy statement and really hit a couple of key issues, the areas of contention between community and research, and I'll come back to this slide a bit later. Community themselves have identified the need to monitor researchers coming in and wanting to conduct research. National Aboriginal Health Organization in 2004 created a document. It's called the OCAP Principles. A lot of people quote the OCAP Principles. That research being done in First Nations, Métis, and Inuit communities needs to be controlled by the community, right? It needs to start with the community. Ownership. Community has to own the research. They have to have access to the research, the results of the research. They have to possess the research, obviously ensuring that confidentiality is maintained with research participants. The 5 R's also have influenced approaches to research, so ensuring respect, reciprocity, giving back. You're not just going in helicopter research, right? You go in with that helicopter and you come back out, you got what you needed, you leave the community in disarray, and nothing comes back to the community. So there has to be reciprocity. What's the benefit for the community? There has to be a benefit to the community. REB members look for the researcher to state what is the benefit to the community. That has to be there. It's part of the TCPS. Relationships, very important. Responsibility and relevance. It has to be relevant to the community. NAHO, the National Aboriginal Health Organization, which no longer has funding, and all of their material will come off their website in December 2017, also produced a document about the 6 principles of Métis research. So again, reciprocal relationships, respect for individual and collective identity, safe and inclusive environments, recognizing diversity. I can make these slides available for folks if you like. I see people writing, so just so you can listen if you don't want to be frantically trying to keep up, because I'm going to go through some of the slides a bit quicker. Relevant, benefit for all, accurate, accountable, things that are, these are kind of like no-brainers, right? But why do we have to state it in the first place, right? We have to state it in the first place because of the atrocities that we discussed earlier. And having the Métis context, understanding the history, values, and knowledge. Research in the North. REBs know this, so if research is being proposed in the North, there's actually separate ethical review processes that people have to go through, right? So the Association of Canadian Universities for Northern Studies, the Aurora Research Institute, and the Nunavut Research Institute. It depends on where the research is being proposed geographically, but they have their separate ethical bodies. Why is that? Research has been conducted in a non-ethical way. That's why these things exist. People just don't dream this up and say, hey, let's make some work for ourselves. That's not the reason why it exists. It exists because it has to exist. Okay, the TCPS, Chapter 9. Folks who know research ethics, prior to 2010, the Tri-Council policy statement included Chapter 6, which I think was titled Research with Aboriginal People, perhaps. And in 2010, there was an extensive revision after community consultation across Canada. And Chapter 9 now is the chapter on doing research with First Nations, Inuit, and Métis people. Prior to Chapter 9, I started working at Ryerson in 2005. I finished my PhD in 2007. So I was pre-tenure, pre-PhD. And in order for me, this is before TCPS, in order for me to do research in any First Nations, Métis, or Inuit community, I have to develop relationships. Nobody told me that. Nobody tells us that, but we know we have to engage community, right? But there was nothing that existed really in the Indigenous literature that said that, right? Linda Toolway-Smith wrote a book on decolonizing methodologies, I think 1999 was her first publication. And then there were publications after that. But I knew practically what I had to do. But that wasn't seen as valuable from the institution's perspective. Institution's perspective, if I want to get tenure, what do I need to do? I need to publish in high-ranking journals, that the community I'm working with will never see, in a language, English, and I'm speaking the same language, but using terminology and words that are not accessible, so publishing in an inaccessible way. I have to get the grant funding, right? These are the things that you have to get for tenure. And I remember going to my dean at the time, because I was pre-tenure, our department was in disarray, and I said, okay, how am I doing? Am I on track? Yeah, you're doing good. And I had showed her a community report that I did. And she goes, yeah, you got to stop doing that stuff. You have to stop doing that. And I zipped my mouth. I didn't say anything. And what I did, I went to the community-based research literature to validate my involvement with community, right? But it still didn't matter, right? Those publications in high-ranking journals mattered. Now Chapter 9 comes around in 2010. They did a most recent revision in 2014. There might be one for 2015 as well, but wasn't majorly revised. Comes along. Chapter 9, if you haven't read it, it states over and over and over in almost all of the articles that you have to engage community. From the beginning, from before you even get your funding, right? How do you know your idea is needed in the community? You have to engage the community to find that out. So then my work was validated through the TCPS. So anytime anybody says, well, why did I literally worked for 2 years on a research project with community that never got funding and didn't take off. 2 years. And that was okay. Did my faculty appreciate that? Did my dean appreciate that? Perhaps not. Did I tell them? No. I just didn't say anything, right? You're not going to say what you're doing if you don't have any, tangible things to produce. But, engagement with the community, I still have that to this day, right? So research money didn't come out of it. Research didn't happen, no research report, but that involvement with the community is still there to this day. And other things obviously happen as a result of that. So after Chapter 9 came out, a little bit more happy. 2014, I already mentioned it, was the most recent revision. And there are 22 articles in Chapter 9 that spell out how research should be, and I say should for a reason, must be or should be conducted to help with First Nations, Inuit and Métis people. For those of you who don't know, the Tri-Council policy statement really comes from the 3 major funders in Canada. So Canadian Institutes for Health Research, Social Science and Humanities Research Council, and Natural, Social, and Engineering answer. I obviously don't know that one very well. So those are the 3 major funders in Canada, and they wanted to ensure that any research that they fund is ethical. So they're the producers of the Tri-Council policy statement with consultation, at least for Chapter 9, with consultation to see how that research should be carried out. These are federal guidelines that should be abided by. At Ryerson, not saying we do it the best, and it was prior to my involvement as chair, but we require expertise on the review board itself. So there has to be someone on the review board with expertise in the area of First Nations, Inuit, or Métis research. Do they have to be Indigenous? Doesn't state that. Just so happens that the folks that we have on board are. Excuse me. Some people have an education council or a council that's separate, and the protocols are reviewed by those councils. And others do not have either of that, but they review it and we're supposed to have the appropriate expertise on our research ethics board. That's a requirement. So let's say we have an REB put together and we get a protocol and we don't have the expertise around the table. We're expected to get that expertise to the table. So someone should have that expertise at minimum. So the beginning of the articles, they first start by defining who is this chapter applicable to. And they talk about Aboriginal peoples from the Canadian context of our political identities as Inuit, Métis, and First Nations. And it recognized the diversity within groups. It's not meant to be applicable for Indigenous peoples in other countries, because that's outside the jurisdiction of the TCPS. But it doesn't mean that the articles will not be valuable to other populations. And in fact, a lot of the feedback that the TCPS folks are getting is that Chapter 9 should be used in other communities that have experienced some of the similar atrocities. So today in the class we spoke about the Tuskegee experiments in the US with African American men and syphilis, and knowing that there was a cure for syphilis, but continuing the research to see how actually people died of syphilis. And that was the intent. So something like Chapter 9 would be a benefit for other populations, and some researchers do comment on that. There's a requirement to engage the community when research involves Aboriginal lands, any recruitment that is specific for Aboriginal people, if it involves cultural heritage, artifacts, or traditional knowledge. The thing about this, though, if the artifacts don't involve humans, as TCPS talks about human participants, then these ethics do not apply, unfortunately. It's only involving humans, people, when you're talking with people, or if someone is a research participant or research subject. When the interpretation of the results will refer to Indigenous people. And then Aboriginal as a variable. So, one of the things that I've encountered, well, typically quantitative research, but it could be qualitative research as well. Go ahead, Michael. Maybe we can get you to sit here.
Go ahead.
And maybe on the other side, come through, yeah. So Aboriginal as a variable. So sometimes we have research and you're asking demographic information. So you're asking ethnicity, right? And in ethnicity, you want to include Aboriginal as a variable. Like we want to include Aboriginal as a variable. But what are the chances is that your research will allow you to infer anything about Aboriginal people? So here I give an example. Winnipeg is very unique because I think almost any research done in Winnipeg, you probably will get enough participants, depending on what the topic is, to infer results related to the Aboriginal population. That means you have to engage the community. That Chapter 9 kicks into effect at that point, right? So if research comes across your table at University of Manitoba involving a topic that is highly relevant to the Aboriginal community, like we talked earlier about, just under 50% of First Nations, Métis, and Inuit are in care. If your research involves children in care, you need to consult community before you can come up with your research idea, right? So one of the things we've done is come up with a little blurb. This is very wordy, but I'll go through it. Because we want to ensure that the researcher knows, in the end, if for some reason they can infer results back to the Aboriginal population, they had a responsibility to engage community. So we have a blurb. You're collecting demographic data on ethnicity, which includes First Nations, Inuit, or Métis. And then we quote the article of the TCPS. Article 9.1d of the TCPS states community engagement is required for research in which Aboriginal identity or membership in an Aboriginal community is used as a variable for the purpose of analysis of the research data. Those are direct words from the TCPS, right? Not an interpretation, it's a direct quote, although it's not quoted. Plagiarism, you know. We don't care about that type of ethics, right? I state it's the TCPS though. While your project it's actually in our online form. While your project is not specific to the Aboriginal community, you are asking questions about Aboriginal identity. If the data you collect allows you to analyze this specific variable, and you will be making inferences about Aboriginal people, you will be required to engage the Aboriginal community in question prior to publishing such results. So we've actually included this. And I received a lot of opposition, even from my REB members. Well, you can't make people engage the community simply if they have Aboriginal as a variable. That's not what this says, right? That's not what this says. Is if for some reason you'll be inferring results after the fact, and again, TCPS is not retroactive. Like, we don't approve things after the fact, but it's kind of the only way we can get around this, right? Where you might, so researchers will be aware if they are going to use this variable and analyze Aboriginal as a variable, they do have that requirement. Any questions about that? Yeah.
Let's say you're doing research in Winnipeg.
Mm-hmm.
What is the Aboriginal community in Winnipeg? You know, this is a city with a huge Indigenous population with lots of different groups, organizations. Where would you start?
Yeah, good point. So I think I have a lot of people who ask that. And I usually put it back on the researcher, right? If you need, in Toronto, for instance, we have the Urban Aboriginal Population Study, or People Study. And in that, people said very strongly, no Aboriginal agency in Toronto represents me. So again, where do you go, right? How do you engage? Really depends on your topic, right? So, you know, if it's a student researcher, master's or thesis, or even doctoral research, get an advisory group together that you go to and get feedback on. But I think with researchers, depending on the topic, if it involves child welfare, Native Child and Family Services in Toronto, right? If it involves health, Anishinaabe Health Toronto, right? There's many Aboriginal agencies in Winnipeg, right? Or several, maybe not many. Just that engagement. If you're doing research at the university, right? Go to Miigwech Agaman. Did I say it right? Yeah. You know, if you're proposing research at the university with Aboriginal people, you need to go and speak to those folks, right? So it really depends on the type of work you're doing, and that engagement has to happen, right? I do have a slide a bit later about authentic engagement. Yes.
When we talk about Aboriginal people, more and more, when I speak about Aboriginal, the term Aboriginal, it's becoming less important in this way, because over the years, students have been coming to my office asking for Aboriginal culture. What is Aboriginal culture? But after a point, I smartened up and I realized that I'm not teaching them or talking about Aboriginal culture. I'm actually talking about Ojibwe culture or Anishinaabe culture. And the same problem, if you want to call it a problem, the same issue applies to the term Indigenous. Although Indigenous has a little bit more hooks into it, in a positive sense. Yeah.
And globally, right? Like the term used for Indigenous. And the TCPS actually doesn't discuss this at length. Like this is a very deep discussion about Aboriginal identity or Indigenous identity in Canada. And Aboriginal is a colonial term. Indigenous, First Nations, Métis, and Inuit are political colonial terms. They all are, right? So if you're identifying with a particular group or a particular culture, Anishinaabe, Haudenosaunee, right? You're talking about the specific group. In the class I'm teaching right now, I think almost every day I've emphasized, you know, identity. And our political identity isn't really who we are. Our political identity is defined by the Indian Act, or not, right? And then we have our cultural identity, or not. The colonization has worked quite well. So I think for the TCPS, they've resorted to the terms used with the Constitution, right? Aboriginal as three groups: First Nations, Inuit, and Métis. This is where I kind of get myself in trouble sometimes. And as a chair of the Research Ethics Board, when I have that on, I'm probably a little bit more careful. But if it's a student of mine, I'll usually say, okay, I'm going to take my chair hat off right now and talk to you as a researcher. If somebody comes to me and they don't know how to engage the community, that's a red flag, right? If they don't know the political identity in the first place, and they don't know the community makeup initially, and they're already down this road, right? I state to people, you have to understand the political identity of the people you want to do research on, right? Because at that point, it's research on. And not to say that if someone is First Nations, they will understand Métis political identity. I had a student come, First Nation status, and wanted to do their research project on the Métis. And I said, and they asked me, like, how do I engage? And I said, do you know the political bodies of the Métis? No. Go and do that, and then come back and talk to me. Because it's not my job to teach you. It's not my job to teach you about that identity. Like that, and it's not taught in our education system, unfortunately. And I'll say, why are you interested in the topic? Like, what sparked your interest? And then from there, really understanding where someone is coming from, right? And trying to shape that. Chapter 9, 9.11 talks about demonstrating engagement. having research agreements and letters of approval. Researchers are very savvy on how to word things appropriately to show that engagement is happening when it really isn't, right? Is it authentic, right? How can you determine if it's authentic? You have to know the community in question to know if it's authentic, right? So an example is Six Nations, right? You think about a reserve community. Oh, well, you have to have Chief and Council, right? Chief and Council approval. Six Nations have clan letters. People go to the clan letters for approval, right? But if you didn't know that about that community, so if you're on the Research Ethics Board, or if you're a researcher and you don't know that, you won't know the political structure internally, right? The TCPS does talk about complex authority structures, right? And especially in the urban center. And with well over 50% of people not living on reserve and living in urban centers, how do you engage the urban community? And that's where I pose the question back. How do you engage the community, right? Like, who is the community you're talking about? What is the topic, right? For people to come in cold, it's not a good thing to do, right? To come in cold and want to do research on Aboriginal people, highly problematic. So there has to be some knowledge there. I was going to say something, but the point left my brain. The TCPS talks about communities having diverse interests and ensuring that there's collaborative research, respectful relationships, and that there's participatory design, so community is continually involved. So these articles emphasize over and over and over the need for engagement, authentic engagement benefits. In class, we're talking about, and I think it's Joni's article that talks about this. We live in an environment where white is superior, Western is superior. We live in a white supremacist environment. Terminology is a little bit touchy there, right? Mutual benefits. We get people around a table, and if we acknowledge that we live in an environment where there's white and Western superiority, if we're around a table, can we actually be mutually beneficial? Can it be mutually beneficial? I argue that there's always power there, right? And I've seen so many examples of engagement that really isn't engaging, right? And they've used all the right buzzwords in their funding protocol, in their ethics protocol, and when it came down to it, they're not even engaging. The example of this is you say, okay, national project, First Nations, Métis, Inuit, how do you get that representation? Have an advisory council. You pull in people from all the provinces and territories, and you have this advisory group. I see this time and time again, where the researchers will not provide enough funding to that advisory group. The advisory group might meet once a year. It's not going to work, right? How are you going to ensure that that engagement is authentic and real, right, depending on the topic? So as a Research Ethics Board reviewer, it's very hard to determine that, because I don't know if you guys actually see your research funding, the research funding proposal. I know that we do not. But is there money set aside, enough money set aside for this engagement? If you're bringing people from all across Canada, including the north, to Winnipeg, and you have 12 people, one visit, how much is that going to cost for maybe a one-day meeting? Any ideas? How much around? 20,000, right? Because we go to the north, Plains, a couple of days, per diems, right? Hotels, right? It's not. It takes money to do this, and a lot of times researchers don't set aside that money. So if you're a community person and people are stating this, say, "Can I see your budget?" There's no reason why you, as a member of a research team, cannot see the budget and question the budget. And if you're part of a community or a researcher as well, being very open and sharing that budget is part of your research agreement. Why not? Right? Mutual benefits. Forgot to put in all these little things to emphasize. Capacity building and strengthening research capacity in community, 9.14. Hire Aboriginal people. Does your REB assess this, right? So this is where REBs typically, research ethics boards typically don't say anything about who someone's hiring. But 9.14 says that you have the authority to ask. Are you asking the question, right? Who will you be hiring to carry out this research? Or how are you going to build capacity, right? Maybe asking that question and using the TCPS terminology. Community can assist in this hiring. And also including these details in the research agreement to ensure that you have something to go back on, right? That you have a research agreement in place so when, you know, as a research team, you start carrying out stuff, well, it was really too tough to hire Aboriginal people. They didn't apply for the job. Go back to the research agreement, right? So you have that research agreement to fall back on. I lost this fight on the research team. And I can't believe I lost a fight, but yeah, I did. I have a black belt fight. But so on a research team, we applied, we got funding, unfortunately. And so you know how that is, eh? We get the money, oh no, we don't do that. We're now going to work with these people. So we were talking and I said, we have to hire Aboriginal people at the universities that we're involved in. And we had a discussion then, and things that were said were things like, well, if I didn't have an opportunity, meaning as a non-Aboriginal person, I wouldn't be sitting here today. If I didn't have an opportunity as a master's student to be involved in Aboriginal research, I wouldn't be doing this Aboriginal research today. And I'm thinking, that's what we've done for 500 years, right? We need to build capacity in community. And we debated back and forth. And in the end, but I was the only Aboriginal researcher around that table. And in the end, it wasn't a requirement. Well, if you can hire someone. And you know, working, you know, at U of M, there are people looking for jobs, right? And I know when I put a job ad out, I do work with the students, right? Say, hey, like, do you know, I might have this job coming up, like, what's your area? And just have a conversation to demystify research, right? Because some people don't apply for these RA positions, these research assistant positions. So doing a little bit of work at the front end, right, and engaging the community. But if you have a researcher at an academic institution and they haven't visited the Aboriginal Student Services and they're doing research in the Aboriginal community, you know, I think that that person should be engaged with the Aboriginal community on their campus as well. 9.15 article talks about the recognition and role of elders, and this is an area that can be a bit contentious in the academy. I'm going to talk about elders first, and this is really coming from my work at Ryerson, not related to research really, but a lot of time academic institutions are hiring Indigenous people to work with their Aboriginal students. And the term elder is being used, right? And a lot of times it's the Western institution coming up with that title, right? It's not it's the title that's problematic. In Toronto, we don't have a lot of elders left. Like they're passing away, right? And then we have people coming up, not recognized as an elder. And so received some money from the institution to hire people to work with our students in social work. And unfortunately, I was responsible for doing that. We put the word out. We got people who were interested. 5 people came forward who potentially could do this work, right? We use the term elder, but we also use traditional knowledge keeper because, you know, in academia we have to have titles, right? So we had people come forward. It happened to be an all Aboriginal a hiring committee, right? So when the person came in, they couldn't come in and say, oh, I'm an elder, right? We asked, like, what do you do and what title do you use, right? Because we don't want to apply a title to somebody. So, you know, there was that engagement and nobody identified as an elder, but I knew that the Western institution is implicated in anointing people as elders, right? And I didn't want to be responsible for that. So I ended up going and talking to 3 of the 4 elders who are recognized in Toronto as elders. And I said, what do we do? So what ended up happening was we ended up having an acknowledgement ceremony. I knew all the 5 people. I didn't know all of them well. I knew some of them a little bit better than others. But what we did was we had those 5 people bring people from the community to acknowledge the work that they have done. And all 5 of them, honestly, have done good work in our community. Highly critiqued some of them, but still, some of them are connecting with our community in a way that the person who's critiquing them in the first place could never think of communicating in that way. So we ended up having an acknowledgement ceremony. So I think from a research perspective, we throw out the word elder. Oh, I want to have an elder on my research project, right? They're advising you. What are they doing, right? Think about what they're doing as opposed to the title that you're giving them, right? And start from there, because the last thing you want to do is anoint people as elder when they're not recognized as an elder in the community. The paying honoraria, I have this as consultant fees. It's not about the whole, tax like the CRA stuff, although that is potentially an issue, and we have that issue at Ryerson, but it's more, when I review, I was a reviewer of Canadian Institutes of Health Research, so I did see the budget with that, and it's community-based research stream, so it has to be community-based. So we could then speak to, where's your budget? How are you actually paying, how are you paying people? When it comes to honoraria for traditional knowledge keepers or elders, what's the going rate? Half day. What do you guys pay here? You don't? You don't? You don't have a set rate? Okay. 250 sound half day? How much? 200 half day? Okay. Full day? 400. Okay. How many people have ever done consulting work? Or have actually submitted a proposal and you require a consultant to come in and maybe do strategic planning for your organization? How much is a daily rate?
450,000.
500.
800.
Yeah. Higher, right? 1,000. Yeah, 1,000, 1,200, 750 for nonprofits, right? How come we don't do that for our traditional knowledge, our people carrying that traditional knowledge, right? I think that the rate's a little bit lower. I just want to put that out there. I've got a duck soon. I think I'm going to start okay. Interpretation and dissemination of the research results, 9.17. This is an area where I personally have struggled. I talked earlier about publish or perish, right? So in the academy, you're really pushed to publish. And you're pushed not only to publish, but publish in journals that are higher ranking. And typically those higher ranking journals are not accessible to community. More and more open access journals are out there. You can search the internet and you can find that. So that's shifting a little bit. But is that really the best way to deliver the results back to a community that you worked with? Publishing and having it on the internet, and then they go search the internet and look it up, right? I think a lot of people are proposing going back to the community, sitting down, having a discussion. When you engage a community in the first place, this project, we engaged 5 communities across Canada. We physically went to the community, discussions, met with chief and council with some communities, discussed the research agreement. It took months, right? Dissemination part, hardly any interaction, right? It kind of falls off, right? To engage the results back with the community, going back to the community and reporting the results in a way that is translatable to a community. Publishing a community report. These are the things that my dean did not like at the time, right? These community reports were garbage, right? Who's going to read that, But that's what's more of more value to community at times, but also going back and sitting down with the community. I'm doing a project, it's not research, but I talked with traditional healers across Ontario, Manitoba, and Quebec, someone who came to Ontario from Manitoba. And one of the things I had to do is come back to everybody and report back what they told me. And I went up to Lake Superior Park. They were doing a fast, and we had our engagement session in the teepee, right? And just reporting back. It's so important to report back. How many people have ever been part of a research study as a research participant? You don't know what the results are, right? It happens too much, right? So as a research participant, impose that you want to know what those research results are. And I really feel that when research starts, people should sit down and say, what is our communication strategy for this research project? What is the priority? Is the priority to report back to community? Is the priority to, and I think there should be a priority, and personally, the TCPS says that, you need to report back to the community. Not making this up, really. You do want to publish in academic journals, too. Getting that information out is important. But it's been my experience that researchers emphasize the latter, right? The publications. To the point where in a research agreement that I was involved in, we have in the research agreement that we will consult with our advisory before anything is published, before any conference is attended. Deadlines. Academia doesn't work that way. Deadline was yesterday, right? So you send and you don't get the abstract done until maybe a week before it's due, and you send it out to the advisory, and you expect them to report back in 2 days, right? Is that really engagement? But you have a timeline. These are your timelines, right? So just thinking about that. Intellectual property. Obviously, there's significant challenges, and the TCPS, I feel, at this current moment, does not adequately address intellectual property from an Indigenous perspective. It's just ideologically different, right? I remember I wrote a chapter and I was talking about pan teachings, right? That everybody's kind of writing about, but medicine wheel, medicine circle. Someone said, well, can you cite the original author? Who knows the original author? And I was like, wow. So I actually have in the chapter, I said APA citation states that you cite the original author. Who's the original author of this traditional teaching? Who knows? But I will cite the first person to provide me with that teaching. So I recognize the traditional teachers, and I cited that as personal communication. For people who are part of a research team and REB reviewers, look at the research agreement for the TCPS articles and look for a point about dissemination and that it will involve community, as well as interpretation of results. 9.19 to 222 talk about biological materials and secondary use data. And again, Dr. Ward's study is not referenced. Actually, they might reference this in the TCPS, but if you're obtaining biological materials from somebody, you need to state what you're using those biological materials for. It's a study on arthritis, right? Sometimes, and pay attention, on consent forms, you'll see the results might be used in a future study that you don't really know what it is yet, but it might be used. So it leaves that door open with biological materials, and for First Nations, Inuit and Métis, that's problematic, and that statement shouldn't exist in the consent form. And then the other piece that I think is missed by a lot of research ethics boards, and now in the age of big data, and even if it's one data set, right? Our community's large, but we know who everybody is, right? I didn't even have my glasses on, and I knew that was you. But certain variables, Fisher River, right? Okay, so if I read something and they block out Dr. Hart's name, and it says Fisher River, and it says something that he's done, I'm like, oh, that's Michael, right? I'll know who it is. We just know. So even though you remove certain identifiers, you're still going to know. So the TCPS talks about if you're going to combine 2 or more anonymous data sets, so it has no identifiers, you think it has no identifiers. If it's 2 or more data sets, it has to undergo REB review, right? So these are typically anonymous data sets. So you receive data and it's anonymous, you don't know who anybody is. That typically doesn't even require REB review or approval. So I've already talked about this, and the picture says a lot. Everybody's unhappy. Nobody's happy. You know, the token Indian, and actually I just realized it's red. I mean, and square and circle. I actually just pulled this from the internet. It didn't have anything to do with Indigenous or Aboriginal, but I can't emphasize enough for people who are from a community or people who are connected to a community that you may find yourself as a token Indian, even though you didn't expect it, right? And that's where, you know, I was in a situation, and it was actually a project, and it was another Indigenous person who this happened, and I didn't clue in, but I was responsible to go and get the community participants, the community agency signatures on a research agreement where money would flow through the PI's agency or institution. So I go to this meeting, the PI is not there, the other researcher is not there. I'm responsible for getting these signatures at the funder. We were visiting the funder. Go to one person. I was on the board. I was the vice president of this board before, and you know, signs. Next person, not signing it. I went, oh, and then I was like, oh no, right? So what it was this Aboriginal agency wanted the money to flow through their institution, as opposed to this Western academic institution. I get it completely. I had no clue that was the environment. Nobody told me that was the environment, but I was the one responsible to go get those signatures. That's when my maintaining integrity principle was born, right? Because I realized at that point, right, I don't think I was intentionally set up, but it was problematic, right? From a funding perspective, when we get research, money flows through academic institutions. It typically doesn't flow through community agencies. But there are examples of where that has happened. My early work over a decade ago, like this is old stuff. Community-based research. Look to the community-based research literature for this, and I think Indigenous research, we have to do this more. Money can flow to an agency that has proper accounting principles, right? So I was the research grants manager for the Tobacco Control Research Initiative, and some of our partners were, you know, CIHR, Canadian Institutes for Health Research, Health Canada. And we designed it so that if someone had a research project and they wanted the money to flow through a community agency, it could. Who gets the 10% admin or 15% admin or 50% admin, right? The community agency as opposed to the institution. Does that advance my career? Does it shoot me in the foot? Yes, right? So one of the things I did with this project, I stayed on board. The money went through the community agency. The other researcher left. And when we were ready to share the results of the research, I invited the president of the university, my dean, my director, everybody, so they could see the value of this research, but the money didn't flow through my institution, right? So there's ways to get the university on board. I think we need to do a lot more work in the funding area. Okay. I think when doing research with the community, it's a lifelong commitment until the community is ready to cut ties. But if the community contacts you 10 years from now and says, hey, remember that study you did? We're looking at applying for funding and we can't fund the study. We want to know a little bit more about the results. I actually term this that you're a lifer, right? I already talked about the identity piece, building capacity I've already talked about, response to funding dollars I've already spoken about. So I think when it comes to researchers, ask yourself why you're doing this research, right? Really self-reflect on that. Because the reason why you're doing the research will come out, even though you're not verbally saying it, when you engage community, right? There will be a certain radar that happens, and they're going to know. People will know what your true intentions are. The battle of epistemologies, I think that when it comes to certain types of research, and this is changing a lot, like qualitative versus quantitative, but sometimes Indigenous approaches to research are seen as less rigorous, right? But I think as Indigenous scholars, you have to demonstrate, and Dr. Hart's written about this, you have to demonstrate exactly what you mean by your Indigenous methodology or Indigenous framework. You have to talk about what is your epistemology, what is your ontology, axiology. But still, I think that Indigenous ways of knowing, being, and doing are challenged in the academy in so many ways. I want to save time for questions. Okay. So this was published in 2004, and these were the points that were made on the document about the OCAP principles, ownership, control, access, and possession. Said the majority of research projects are initiated, paid for, and carried out by non-Aboriginal people. Has that changed much since then? There's a fly, not sticking in my hands. Presenting complete designs, often already funded for community approval, rather than collaborating from the start. It was funny, I did this presentation one time, and afterwards, a young researcher came to me and said, I got this funding, but I didn't engage the community yet. Can you help me? No, I can't help you. It's still happening. Complete designs are being put together, funded, right? And there has been no engagement. Governments gather administrative and other data without Aboriginal knowledge or consent. That's still happening. Analysis and interpretation of data is done without community consultation or understanding of the community. Still happening. Researchers profit professionally and economically from Aboriginal research without employing local people or compensating participants. I think that the compensation is happening to a certain degree, but you know, one of the things when we talk about benefits of research, right? I have master's students typically who the benefit of research is that you're going to get your master's. Let's be clear, right? You're going to get your master's out of this research. That's one benefit that's coming out of it. And what is the benefit to the community, right? So I think that hasn't really shifted. If it did shift, you'd see more and more funding dollars flowing through community agencies as opposed to the academic institution. And I know that's very challenging because how do academic institutions survive, right? These research dollars are very important to an academic institution, but how can you maneuver that? Research funding is not accessible to community or Indigenous researchers who follow an Indigenous approach or epistemology. And I think that's still true as well. Funding dollars, it's very difficult for community to access funding. They have to partner with academics. So where do we go from here? Communities are developing their own research ethics guidelines. Anishinaabe Health in Toronto constantly being asked by researchers to be part of a research study or to be involved in research. And now what they say is, did you read Chapter 9? Read Chapter 9 and get back to me, right? And they ensure that engagement happens. Infiltrate to transform the colonial system, right? I think rather than sit and complain necessarily about research ethics boards, be part of that, right? And implement some change because we need research in our communities. We do need research, but we need it on our own grounds, right? And to be done in a way that is appropriate for our community.